Alright nurses, here I am with a pathophysiology concept map. I'm going to try to focus in on this just a little bit better. I think that's better. So this is our pathophysiology concept map, and the goal is that you can fill these out for certain disease processes and then be able to reuse them throughout your academic career and maybe even beyond that. So this is the form. If you print them out at school, your arrows will probably print out as black, but I do have them here colored in just because I like a little bit of color coding, not too much, but a little bit. And so we're going to do our first pathophysiology concept map. I'm going to use the disease process of pneumonia. So I'm going to go here and write in pneumonia as my disease process. If you want, you can fill it in the top, maybe if you're wanting to have it up there more closer to a title area. And then the other thing I'm going to do is, because our book doesn't have great resources for a lot of diseases, I am going to write my source, and I'm just going to add that right here. And my source for this one was the National Heart, Lung and Blood Institute. For this source, I would require that you use an excellent academic source. So this institute is part of the National Institute of Health. So I didn't put the exact web address, but I don't want you getting this information from WebMD or Mayo Clinic. I want a good academic source of information. So whether that is maybe your med-surg textbook or a good resource like the National Institute of Health or Center for Disease Control, something along those lines would be better than some of the general population information websites like WebMD. So this is where we're going to go first, and next I'm going to move up to the signs and symptoms. So we're going to start one here, and I'll just put a 2 here. That will help us remember which order, and the arrow is here as well. So this is for signs and symptoms, and I'm just going to write signs and symptoms of pneumonia, and you probably already know a lot of these. So shortness of breath on activity, chest pain. They might have pain with a cough or deep breathing. There we go, coughing. It might be productive or non-productive. They might have fatigue and be tired. They might have fever and chills. They might have nausea. They might have vomiting. Okay. They might have tachypnea, fast breathing, or dyspnea, which is difficulty breathing. Their oxygen might be decreased. The breath sounds, and you'll learn more about that in health assessment if you haven't already, might be decreased or crackles. They might have cyanosis, which is like blue tinting, fingernails, lips, around the eyes. Okay, so this is not necessarily, it doesn't have to be an exhaustive list, but it should be with common signs and symptoms. Now, a patient may or may not have all of these signs and symptoms, so you just have to have the possible ones in here. If I was creating this concept map for a particular patient, then I would only put the signs and symptoms that that particular patient was having. Okay, so next I'm going to move over to risk factors. And so I'm going to put a 3 here. Risk factors are what make getting this particular disease process, whatever the process is, a higher risk for somebody. So I think you'll understand it better with our, with our examples. And so age is a huge risk factor. The very old or very young are more likely to develop pneumonia. Smokers are more likely to develop pneumonia. Somebody with a lack of immunity, so somebody with HIV, something like that. Somebody who has some type of environmental exposure, so that could be somebody who lives where there's high pollution or has had a one-time exposure to some type of hazard. Somebody who has other comorbidities. So what does that mean? Somebody with other chronic diseases, so maybe they have chronic obstructive pulmonary disease, maybe they have diabetes or some other chronic disease, maybe they have cystic fibrosis. Somebody who had increased immobility. So somebody who's not using their lungs a lot, they're sitting around a lot, they don't take a lot of deep breaths, type of thing. They're going to be at increased risk. That's how we get risk factor. They're going to be, all these people are going to be at increased risk for developing pneumonia. So now we're going to move down. We're going to follow the arrow to this box here. And so we'll put a 4 here. And this box is asking for the pathophysiology, meaning the definition, the etiology or the cause, what causes that disease process, chronicity or how long it lasts, and the prognosis. What is prognosis? Is what is the likelihood of the person recovering from the disease process. So we'll go ahead and start over here with the definition of pneumonia. And when I looked at my source, the National Heart, Lung, and Blood Institute, it talked about an infection that causes the alveoli to fill with pus fluid. The etiology, or the cause. So what led to this person developing pneumonia? And I see I need to readjust here, focus. So what could cause somebody to develop pneumonia? Well, see how the risk factors are related here? But let's be a little more specific. Maybe they had another upper respiratory infection, a cold, the flu, that caused some fluid to build up in the lungs, in the alveoli, and now some bacteria or other germ is taking over. So a previous upper respiratory infection would be a cause. It could also be immobility, and we talked about that here. Somebody who's been on a ventilator and just having a direct route for germs to get into the lungs. And then when we always look at all the rest of these risk factors as well, as partially being part of the etiology. I'm going to talk about chronicity and prognosis a little bit together here. Chronicity, in the United States, people get pneumonia, most people get treated, and within 3 to 7 days it is on the mend, so that whatever germ that's replicating and causing that fluid to increase has now been cleared out within about 3 to 7 days with antibiotics. And we can look at that and say, well, remember, just because the the germ is cleared out doesn't mean the person feels automatically all better within 3 to 7 days. So, but this gives us an idea. So the chronicity can depend on the cause as well as risk factors. The more risk factors somebody has, the longer it's going to take to get that germ that's causing the fluid buildup out. And that kind of goes the same for prognosis. But one more thing I want to say about chronicity. Pneumonia is considered an acute disease, meaning you have it for a short time, you get treated, and it goes away. Okay. Prognosis also, again, depends on the risk factors. So the more risk factors somebody has, the worse the prognosis. Usually is good for most people who get pneumonia. They get their treatment, they get better, they go on with their lives. However, if somebody has a lot of the risk factors, they're older, they're on a ventilator, they've been a smoker for 70 years, their prognosis and their chance of recovering from this pneumonia is going to be worse than somebody who doesn't have any risk factors. So I'm going to follow the next arrow to the medical interventions, labs, diagnostic studies section. So this is where a lot of times we think about treatment for pneumonia. We'll see and how it's diagnosed. So a patient gets an x-ray, they might have blood work. So CBC, they're going to look at the white blood cell count for infection. They're going to do a pulse ox to measure that oxygen in the blood. They may have a sputum culture, see what's growing in that pus that's expelled from a cough. Less likely, maybe a CAT scan, maybe a bronchoscopy. Much less likely to get those things. Some treatments that they would get, might get some oxygen, some IV fluids, antibiotics. Sorry, my spelling is running out here, guys. They might have some steroids and maybe some breathing treatments. Maybe some other things I'm not aware of. Okay. Maybe. So what we see, the place I want to go to next is the nursing diagnoses section. So nursing diagnoses, remember, are different from medical diagnoses. And you have a whole manual, nursing diagnosis manual, where you can get your information from. And when you go by what's in that manual, it will give you your planning, your interventions, all those things you need. So in this concept map, we're going to be a little less specific than we would be in a care plan, but I'm still going to prioritize my nursing diagnosis. And so because breathing and safety are always up there with priorities, I'm going to choose impaired gas exchange, because with that fluid in the alveoli, the oxygen and CO2 are not getting exchanged as well. I'm going to pick ineffective airway clearance, because the patient is not able to cough up all those secretions. And then I'm also going to choose activity intolerance, because with the shortness of breath, the patient may be unable to do all their activities of daily living that they need to complete to live, whether that be getting groceries, cooking, hygiene practices, things like that. And now the nursing interventions, what is the nurse going to do independently for these specific diagnoses? And so I am going to do respiratory assessment. Frequently, I don't think I need to be that specific here, but just so you get an idea, I'm going to look at the patient, look for cyanosis, signs and symptoms of fatigue, because that comes into play with activity intolerance as well. Listen to lungs, pulse ox, ask questions. Okay, so all those for respiratory assessment. I'm going to give oxygen. That can also be considered a nursing intervention. The head of the bed is going to be up. Okay, I'm not going to be lying them down flat. I'm going to teach some coughing and deep breathing techniques that can help get some air into those alveoli. I'm going to monitor vital signs with the activity. I'm going to offer and encourage fluids. Here we go. Here we go. Let's be consistent here. So I'm going to offer, encourage fluid intake. And I'm going to offer assistance with ADLs as needed. And I might even do some teaching about how some energy conservation practices to help the patient so they can be as independent as possible. So we have independent nursing interventions here, and when we missed a spot up here at the top, the potential complications. And I've left this last for a reason. And the reason is the complications are what occur if none of these are working or if the patient goes untreated. And so if all of our interventions, medical and nursing, were completed, but the patient was still unable to recover, what are the things that could happen? And so sepsis is one. So that is when the germ, bacteria, fungus, whatever it is that's causing the pneumonia, gets into the bloodstream and goes throughout the body. And so that can lead to shock, septic shock. A lung abscess, so that is a pocket of infection. Pleurisy, which means the lining of the lungs can become inflamed and irritable and cause pain. And then it can also lead to respiratory failure, which then can, all of these eventually could lead to death. So death would be a complication of pneumonia as well. So this does go with the prognosis, and it could come up here. And I think as you get more experienced, you probably will just go right up here to the potential complications. But I just wanted to show you that these are the this is what happens if it's untreated or all of these things don't work. Then it goes up to the complications. So this is how to fill out your pathophysiology concept map, and we will be doing this a little bit more in class and practicing throughout clinical as well. See you later, nurses.